Well, good evening, everyone. This is October 31st, 2022, and I am Dr. Ella Thorpe with Ask the Doctor from Tustin Longevity Center here in Tustin, California, Southern California. And we are a functional medicine, integrative medicine clinic trying to look at ways to provide the preventive natural lifestyle supports, advice, guidance that will help you to stay healthy or to help you try to restore your health. And with God's help, we will advise you and work with your primary care doctor, consultants, whatever is needed to help you on your journey through this life. And tonight we have questions. I have several pages. It looks like there were 3 questions from October 17th, 4 questions that I didn't get to. And then October 24th, there's several questions, and then we have the new ones. So this is not meant to be medical advice. This is educational as to how we would try and approach or what our thinking is as we see symptoms, issues, complaints, concerns that patients might have. This is not meant to be personal medical advice. You can type in your questions if you're on YouTube into the chat section here. In the bottom at the link, you can see an email link where you can email questions, and that's how I get these questions right here. I don't see these questions ahead of time, so when I see them tonight, it's always the very first time my eyes have laid on them. So there's no pre-planning here. We're very, very busy, but we're trying to do this as a service to people, to our patients. But again, it's not meant to replace your time with your doctor, a follow-up visit or a telephone consult or a telehealth consult. We are 7 doctors here. Soon you'll be seeing Dr. Johnston scheduled. He's our newest addition, and shortly he will be taking new patients. Dr. Habermill is the second most recent in the past couple months, and she's a blessing. And we have Dr. Mitchell, our gynecologist, Dr. Merrick, and Dr. Kaur and P.A. Patel and myself. So of the 7 of us, we're all trying to honor functional lifestyle medicine. So with that, tonight I want to make a note that you might go on to our Tustin Longevity Center YouTube, and you'll see hundreds of my videos are not there anymore. So it looks like that's a sad thing and all the hard work put into it, but they're gone. There's only a handful that they left. So I guess we should thank the Lord that we still have a channel. Anyway, let's begin tonight with the remaining questions from October 17th. One is from Veronica, and she says, good afternoon. My aunt, who is 71, is having problems with her kidneys and told me that according to her lab work, her kidney level is 38. No, I think I did answer this before. And she's probably talking about a glomerular filtration rate, and that is an estimate on the chemistry, comprehensive chemistry panel. It is the creatinine that you need to follow. Creatinine, creatinine, creatinine. And if it is 2 or less, you should be doing good. And she goes on to say she has diabetes, high blood pressure. What do you recommend for her to do or take? Thank you and God bless. Well, most Americans don't drink enough water, so you have to drink half your weight in pounds as ounces every day. Water is diminished in our consumption as we get older. Our thirst mechanism in our brain, that area shrinks with aging, and so you have to, by discipline and maturity of your age, drink enough water every day. Also, you need to exercise, get a good night's sleep. We believe EDTA chelation therapy is very valuable for the microcirculation and that of the tiny little capillaries in the kidney that help filtration. They're called glomeruli. And there's tremendous research publications over and over about the value of EDTA chelation helping with microcirculation even to the kidneys by nephrologists, and that on people who even were on dialysis, they had such bad kidney function. So that would be our beginning point. There'd be other things like your diet, avoiding antibody formation with food allergies, to eat a more simplified diet, take systemic enzymes and the like. And so that would be a beginning point, Veronica. Let's see, Nancy said, hi, what do you think about baking food in or on aluminum foil in the oven? Don't do it. I would not do it. Do you think that the aluminum leaches into the food? The answer is yes. So if you have parchment paper, wrap your food in it, and then you can put aluminum over that, but do not cook on aluminum. Tiziana says, hi, Dr. E. My sister is 56 and lives in Mexico. She recently started suffering from migraines and asked me if I could recommend a supplement to help her. I asked her if she's on estrogen or any hormone replacement. She said that her doctor recommended to her to stay on the contraceptive pill till her period stops. Then do a hormonal blood panel and evaluate what hormones she may need. What is your opinion about that? Also, can you recommend a supplement for migraines, maybe magnesium? Thank you. So if she's 56, again, when I was a younger doctor in the 1970s, I started practicing towards the late 70s. We would see women who were in their late 50s still menstruating on their own. It doesn't look like she's menstruating on her own in that she's on birth control pills, so she's on some synthetics. But she clearly would not have at that age any functioning ovulation. I don't like the birth control pill or the synthetics. I don't like progestins, and that's what typically is in the birth control pill. I like natural human bioidentical progesterone. And progesterone in and of itself has had help in reducing migraines. So 200 milligrams taken at night, every night. Some people go up to as much as 800 milligrams, and that seems to do them very well. But she needs to be under the care of a functional medical doctor who is familiar with natural hormone replacement therapy in women and who are able to check the hormones and support with bone density. She would need a bone density. She would need to have her hormone levels done. Typically, the birth control pill does not have adequate levels. They're just kind of bare minimum synthetic progestins, and some do have estradiol. So if she were to see me, I would have her stop the birth control pill. I would put her on natural estradiol, somewhere in the realm of either topical or a patch or even an oral, and get a baseline dose. I usually start with 1 milligram cream topical daily, and then I give them the progesterone to take at night. I would have her go on enzymes, which are anti-inflammatory and help prevent the vasospasm from the inflammation that usually is triggering migraines. The enzymes I would use would be things like Vitalzyme or Vascuzyme. I would insist that she drink half her weight in pounds as ounces of water every day, and to exercise daily, to put in at least about 20 minutes of a rather aggressive, brisk walking. And then I would have her use, besides those enzymes, like Vitalzyme or Vascuzyme, 4 or 5 twice a day on an empty stomach, and then the magnesium, either straight or as a multi-mineral vitamin mineral supplement. And then I would have her avoid corn, soy, legumes, beans, and just have her eat natural wild-caught fish, turkey, chicken, beef, and vegetables, but to stay away from corn, soy, legumes, and grains. I'm sorry, I wanted to add grains in there, like oats, wheat, malt, and barley. And then let's see how she does. That would be the direction I would head if she were my patient. Um, and that should be a blessing to her. Lisa asks, I've been diagnosed with cataracts in both eyes and epiretinal membrane in one eye, both of which have started to affect my vision. I've been doing EDTA chelation monthly, and I use the Beamer pad on my eyes with a 2. I was recently told to get natural ophthalmics or silmalacin eye drops to help treat the cataracts and hopefully prevent further surgery. Have you heard of these, or can you recommend them, or any additional to keep my eye healthy and seeing? Well, I don't know how many total chelations you had. Having 10 EDTA chelations a year is a very good thing. It's preventative. Uh, the antioxidant damage of aging to the eyes through all the light that comes through can oxidize the proteins that are in our cornea and then the lens and in the vitreous fluid that fills the bulk of the pressure of the inner eye. The retina are just, hundreds of millions of rods and cones that have supply nerve, vein, and capillaries. So you need that microcirculation help with chelation therapy, plenty of water, systemic enzymes, regular exercise, low carb diet, and avoiding food allergies that would clog up those little capillaries. I am not familiar with those 2 eye drops that you have listed here. And so I don't know what to say about them, natural ophthalmics or silmalacin. So I can't make a recommendation about that. But as we age, we all dry up, and you get a syndrome called SICA, SICCA, SICA syndrome. And if your estradiol levels are not good enough, then your eyes will dry out more quickly. And that will add to the oxidative damage and stress. So it is a challenge, and we're all trying to work as best we can, but these lifestyle recommendations would be the direction I would go, Lisa. And possibly you would need a burst of EDTA chelation, doing it once or twice a week until you get through a series of 30 compressed into like 6 to 7 months, and see if that doesn't lighten everything up and help you with that. The next page is from October 24th. And Debbie, this is Debbie Vishulis, my sister. Okay, so I better answer that. That's my sister. A friend has rheumatoid arthritis. What suggestions can you give for any proactive steps to help? Thank you. Well, I would want to find out her blood type. This is so common in the O-type blood. It can happen in other types, of course, but it's most common in O-type blood. And I would get them away from all grains completely, 100%. Probably the best thing I would recommend is to do a carnivore diet, eating wild-caught fish and prairie-raised grass-fed beef, things like that, and then go on to a high dose of Vascuzyme or Vitalzyme and drink half their weight as pounds in ounces, as ounces of water every day. And then I would I would have them see a doctor who would look at their sugar levels, their food allergies, their gut health with a complete digestive stool analysis, those kind of things, because we tend to do very, very well with people with arthritis. So systemic enzymes, go carnivore with wild-caught foods, which is low carb, plenty of water, and let's see the direction she goes there. Harlow says, hello, Dr. Rita. My thyroid levels have been in the required range, but on the low end. I've been taking iodoral 12.5 milligrams daily, but my endocrinologist said that the iodine will suppress my thyroid. That's interesting. What is your recommendation on this? Well, iodine is required for your thyroid hormone to behave and act as a normal thyroid hormone. So I don't quite understand why he said that, or maybe you misunderstood. You can do a test. We can run a test, which is a 24-hour urine iodine, and we can see whether you're low on this and need this. But most Americans, I would say up in the high 90s percentile, most Americans are deficient. Is there a supplement that can bring the thyroid levels up to avoid taking the prescription? I will say there really is not. Not to my knowledge that has really worked. I know there are some things out there that purport to do that, but I have never really seen any supplement that is able to do that. We like to use natural glandular thyroid products, but I would start out with a 24-hour urine iodine to prove that you need it. June asks, my husband has peripheral neuropathy. He has no pain, but is having increasing problems with his balance. I have heard of a treatment for peripheral neuropathy, which includes high level of progesterone and high levels of vitamin D, combined with use of a hyperbaric oxygen chamber. I've never heard of that. She's asking me if I've heard of this treatment. Do you think it has some value? I've heard of hyperbaric treatments enhancing nerve function and reducing peripheral neuropathy. The nerves are covered with a fatty myelin sheath, and this is damaged with aging. And so her husband is, I know who he is, and so he's in his early 80s, and this is not unusual to see at his age. EDTA chelation will help it, drinking enough water will help it, eating the healthy fats will help it, but I have never heard of this progesterone and high-dose vitamin D. So that's something new to me, and maybe I'll look into that down the road, June. But that's all I can say. Yes to the hyperbaric oxygen chamber. June also, so that's a duplicate. Okay, Diane asks, MRI contrast contains gadolinium. That's right. Gadolinium is a heavy metal which highlights any abnormal physical issues for the radiologist reading the scan. Yes, that's correct. Problem is, it has been found to store in the bones and brain. That's correct. What is the best way to flush this heavy metal out of the body, and how soon after one is subject to this metal contrast should one flush it out? Would taking charcoal right after the procedure help, and if so, how much? The real thing would be EDTA chelation therapy. We do this all the time. We see the gadolinium go down after people take an IV chelation. So I would certainly come in. We do take walk-ins. We give a reduced dose. Our nurse screens you to make sure there are certain contraindications to it. And if you pass those questions and the brief exam they do, you can get a chelation IV here as a walk-in. You have to call to schedule first, but I would see a doctor who does EDTA chelation. You can go to acam.org, acam.org. These are physicians who have been trained and certified in EDTA chelation administration, and that is the best way to do it. Now, is charcoal of any value? Well, charcoal may have some minimum value, but I'm not going to say that it will do anything to pull this out of the brain or the bones. It's really going to have only effect in the how do you call it, the gut, in your gut from what you were eating in your food. So that's what I have to say about that. Okay. All right. So next question. Manja says, hi, Dr. E. Can calprotectin level in the stool be elevated if X-ray of abdomen showed backed up stool in the right and left area of the colon? It's going to create, you'll be retaining waste material, and that creates a bit of an inflammatory response. So I would say absolutely the calprotectin can go up. What would be your approach to that? Well, we have to find out why are you constipated? Why are you not moving? So are you drinking enough water? Are you exercising? Are you following healthy lifestyles and sleep cycles? Are you eating a diet that is supportive for peristalsis? Do you have enough minerals in you, like magnesium, potassium, calcium, and so forth? And usually, if we give the multi-mineral TLC multi-min has the magnesium, the potassium, the molybdenum, and so forth in it. This is helpful along with the water, along with exercise and a good night's sleep and not eating late. Enzymes help move it along. Probiotics help move it along. The other thing would be to use occasional use of herbal laxatives. We use here Super Aloe 450. You could use for a few days, but it's getting your constipation and that bowel moving. Hopefully that helps you. That's the direction I would head with your doctor. Barbara says, hello, Dr. Ellithorpe. My husband and I have been watching your YouTube program for a few weeks now and really enjoy it. Well, thank you very much. Pray for me and that we can speak truth here and not be censored like we apparently are, because I lost hundreds of videos and lectures that are now, I guess, lost. All right, we've listened to you talk about eating a mostly animal protein and veggie diet. Could you give us an example of you might eat on any given day, and if you eat any extra carbs or eat any carbs? I tend to try to be mostly a carnivore, but if I eat, I'm going to have broccoli, Brussels sprouts, green beans, asparagus, spinach, and those are cooked. I tend to eat only once a day or in a very narrow range of hours. Typically, I eat between 3 and 6 p.m. I try and stop eating completely by 6 p.m. I have meat. I cook up roasted chicken, salmon, and pork. I have in my refrigerator right now, I have maybe 2 pounds of bacon that have been pre-cooked up. I have pre-made up hamburgers. I have pre-made up sausage. And then I have hard-boiled eggs in my refrigerator. I have, I do eat salads so that when a true holiday treat comes, I can tolerate that. All right, then she says, also, do you suggest eating the food suggested from the Eat Right for Your Blood type? Saying and really pointing out largely the blood type A is the person that has the trouble more, and they need digestive enzymes with betaine hydrochloric acid to help them digest their proteins and fats. That's why most A's have trouble with staying well and restoring their immune system and repairing themselves, because if they don't digest their food well, have trouble with staying well and restoring their immune system and repairing themselves, because if they don't digest their food well, they don't rebuild their body well over the years and decades. So outside of that, people are too unique to be able to have a book that says, if you're a B, eat this way. If you're an O, eat that way. If you're an A, eat this way. That's too oversimplifying. Blood type A as a class in general, from even your youth on, from childhood on, needs some help with digestive enzyme with betaine hydrochloric acid. All of us, as we age, we start digesting less well, so that by the age of 50, 55, many of us, including myself, I've been using OrthoDigesThyme, which is the enzymes and betaine hydrochloric acid, since my late 50s. So I've been on it for well over 10 years, and it really helps me. And O-type blood people tend to make too much acid as a general rule, and they can probably go later in life, maybe into their 60s, before they need to use the digestive enzyme support. But outside of that, that's pretty much the only goals that I have found consistent. Patsy says, I have read that if you get COVID, that you should begin rinsing your nasal passages with a saline solution within 24 hours of getting sick so that the bacteria cannot multiply. It's a virus or allegedly a virus. Does this work? My husband and I are around grandchildren and that constantly have colds. So would you recommend daily use of a zero point 0.6 PVP oral 1 nasal spray? We also have allergies, stuffy nose all the time. And is there a nasal spray that would help us breathe? Well, I use Argentin Silver. Argentin is nanoparticulate um, hydrosolized nanoparticles of silver. Silver is traditionally antiviral, antifungal, and antibacterial. And it is absolutely harmless. And I will put it in my eyes every night to help moisten them before I go to bed. Also to kind of cleanse them. I will put it up my nose every night. And if I, at times, I'll brush my teeth and take a sip out of my jar and swish and swallow. So I swallow it. So that is the number one thing that I use. It's been universally understood for thousands of years that people who have silver in their silverware or drink out of silver cups, that's why, the rich could afford the silverware, and they stayed healthier longer. The term, he was born with a silver spoon in his mouth. This is quite well understood. You could take and do a test at home. Take some milk and put 2 glasses in a room, 6, 8 ounces each. One glass, do nothing to. The other one, take a silver dollar or a half silver dollar coin and just drop it in the milk. Come back 2 days later, look at the 2 milks, and you'll see the one without the silver has already separated out. The solids have fallen down, but the other one will still look at fully formed and um, appealing to drink. I wouldn't drink it though, but it just shows you silver is antibacterial, antiviral, antifungal. That's what I would do, Barbara. Patsy said, oh, that was Patsy. Okay. Leah said, I am currently doing the EDTA suppositories for heavy metals and wondering exactly how they get rid of the heavy metals and also if there are any other benefits of using them. Also, a supplement called Ultimate IgG from Just Thrive. I'm wondering if you're familiar with it and if it's helpful with detox. I'm not familiar with Ultimate IG, so I can't comment on that. EDTA suppositories, I'm the one with the team out here and the science researchers, and we were published on using the EDTA suppository on men who had prostatism, which means they had painful chronic prostate swelling, urination flow problems, getting up frequently to pee, chronic prostatic pain, and so forth. And we put in the EDTA suppositories, 1,500 milligrams in each suppository, and they used it every single night for 3 months. At the end of that time, they had such improvement in the International Prostate Symptom Score assessment on all these problems. There was such statistically significant improvement. Their microcirculation improved to their prostate and the area there. Even their erectile function seemed to have improved, and their pain reduced, their swelling diminished, their flow improved, and their pain diminished. So I would say these suppositories work by catching on to free radical oxidizing heavy metal toxins that we're full of. And after we start getting age 40, our own bodies start losing our bone mineral density, and we kind of throw off the added heavy metal toxins we've bioaccumulated for the half century, prior. So not only are you eating and drinking and breathing it from your daily exposure, now your own body is eliminating it, and you're getting a double whammy, so to say, of oxidative stress from these heavy metal toxins. So when You put it in the suppository. The venous plexus around the rectal area there is designed to reabsorb the water, so you don't have this watery stuff coming out. You have formed bowel movement stools. And when that venous plexus is there where the EDTA is, it enhances absorption of the EDTA, which gets into your pelvic region there and supports microcirculation, and your own immune system works to heal you. Of course, if you drink enough water and move, walk, exercise, take systemic enzymes. Now, and then we did the animal studies. We did the pharmacokinetics on this, and we saw there was a biphasic phase of absorption and enterohepatic recirculation. So we were quite pleased. We actually applied for a new investigational drug application using EDTA. It's been approved by the FDA for lead removal in children. And so we were seeking new drug investigation for another purpose. But of course, we're not multi-billionaire millionaires, and who are we that we should even think of something with 30, 40, 50 years of medical practice and experience that we could come up with some good idea to benefit mankind. And so after spending our money and hundreds and thousands of hours on it, they just squashed us. So that's how it works. It pulls out oxidative stress, heavy metals. Next question is Patricia. Hello, Dr. E. I had 3 bouts of vertigo. The first around 5 years ago, and then 2 more in the past 3 years. I have done the Epley maneuver each time with success. That's moving yourself in different directions to help you with it. I understand that this is a crystal in the ear that becomes dislodged. However, I don't know what causes that to happen. It's aging, because vertigo is usually benign positional vertigo, comes on to most of us with time and age as we dry up and wrinkle up and crack up, so to say. And so that's why it's so important to drink your water, not have sticky high carb diet, and to exercise regularly, and not eat food allergens that make sticky antibody antigen complexes in your blood. Is there anything that that brings these episodes on? Yeah, not drinking enough water, not getting a good night's sleep, eating a sticky high carb diet, eating food allergies that create antibody antigen antibody complexes, and so forth. So that's my answer, Patricia. Linda says, do you recommend a flu shot for a 92-year-old man? Sounds to me like he's done quite well. He has Parkinson's and a little difficulty walking, but doing very well other than that, I'll say. So I am not a primary care physician, and because so many of my hundreds of my YouTubes have been taken down, I'm going to have to say I have been muzzled and have been not made able to tell you what I really think of this stuff. And I am for taking zinc. I am for using vitamin C. I am for using vitamin D. I am for a low carb diet. I'm for drinking enough water. I'm for doing exercise. I'm for stressing the importance of not eating late. I am for suggesting getting a good night's sleep, going to bed, 9:30 the latest, and getting up early. So that's how I would approach that. Linda says, do you recommend a flu shot? Oh, that was Linda. Denise says, hi, Dr. Rita. Is glutamic acid good for a 92-year-old Alzheimer's patient? I read something both ways, so I'm confused. Thank you, and God bless you. There is, when people take supplementations and isolated high doses of individual supplementation without a doctor's oversight, then there is possibly some issues with the glutamate pathway, and this can be an excitotoxin to the brain. So I would say eating a healthy meat, fish, turkey, chicken, beef, eggs, and using a good multivitamin, vitamin D, systemic enzymes, iodine, a good multi-mineral, and systemic enzymes. These are the things that I would suggest, as opposed to looking for these weird protein shakes and amino acid concentrates. So that's how I would approach that. Adrian says, my husband wakes up often with these red marks on his face. What causes these? Usually they are on the side cheek, red marks. Well, that could be all kinds of things, Adrian. I would assume, I'm presuming that you're in your 50s or 60s, and microcirculation can be diminished with the pressure of the head on the bed, and you can get tiny capillary ruptures, but I would have to see it in order to see exactly what he's describing. Hopefully you guys don't have bed bugs or stuff like that would be attracted to him as opposed to you in the bed. But I have seen that where a couple will have, one will get all the bug bites and the other will not. So Adrian, that's something you have to go to a doctor and let them actually see this, because it could be all kinds of things. Pamela says, I just started ciprofloxacin today. That's an antibiotic, and want to make sure I treat my gut biome right. I would appreciate reminders on how to fix the biome. This is my third diverticulitis flare in the last 2 years, and stress, decrease in exercise has always been part of the cause. This one didn't clear up as quickly with non-antibiotic interventions and the diet, so took the first pill today. Well, I would take the powdered form of probiotics. We use here the Orthobiotic 225, Probiotic 225. These are little packets, and this is 225 billion CFUs per packet. And I would mix that in water. Typically, I would mix it with our the protein immunoglobulins and the phospholipids that make up the lining of the gut. So the lining of the gut, these double layers here, are phospholipids, which is BioPC+. These are the immunoglobulins, like immunoglobulin A, salivary secretion to help you protect your gut. And this is the probiotic I would use. I would do that for 2 weeks. Then I would get on your capsule of orthobiotic, and I would take a double dose, 2 capsules a day. And I would do that consistently until you're stable. Let's see, what's next? Then I have, now I'm up to date, I guess. This is the newer questions. Dolores says, hi, Dr. Rita, I'm 70 years old from Fullerton, California. I'm visiting my son in Tennessee and had fall of few steps. I ended in the ER and admitted hospital and had surgery for spiral femur break. Was in hospital 4 days, now at son's home. Question: given anesthesia, antibiotics, pain meds, and blood thinners, and have not taken my supplements, had problems, did not have a bowel movement until my sister shipped me 3 doctor's bar once received. I ate one and drank lots of water with lemon, and I had bowel movements. What supplements do you recommend? Well, the doctor's nutrition bar is a powerful bar that we created to put all these phospholipids into it to help with healing the gut immediately, since most people don't eat enough meat, fish, chicken, turkey, egg yolks and stuff. So we created this for that reason. There's 15 grams of protein, 15 grams of fiber, both soluble and insoluble in here, and it won't raise up your glucose and insulin levels. So that's why we developed this. Everything we do is to try and help our dear patients here. And yes, yeah, that really works. And the other thing is drinking that water. You can so easily fall out of getting in your, 60, 80, 90 ounces that you need every day. And then probiotics would be the other thing I would suggest as well. My stay was for 8 days. Now, orthopedic surgeon says no flying, no weight bearing for 10 to 12 weeks. And he stated femur is one of the biggest bones. That's true. He stated, I am now with osteoporosis. I greatly appreciate your help so I can order and ship so I can start taking your supplements. I am a patient with Dr. Kaur. God bless you. And God bless you. Now, natural hormone replacement like progesterone and estradiol and vitamin D, 10,000, probably 20,000 would be good to take. And then when you get back, we could check your levels, maybe 10,000 one day, 2,000 the next. I would try and have your doctor there measure your vitamin D level, but take close to 20,000 international units a day to help you rebuild your bones and strengthen yourself, and talk with Dr. Carr about your natural hormones to support that and many other things that we could do. Cynthia, this is a long question. I'll say, I don't know if we can take that much time. Hello, my husband and I have appointments to see Dr. Merrick in March of 2023, the earliest appointments we could get with one of your physicians. In the meantime, I would like advice regarding high blood pressure. I'm 73 years old and have blood type O negative. I am slightly overweight, active, Pilates, aqua, exercise, worship, dance, eat organic produce and dairy products, wild-caught fish, grass-fed beef, poultry, whole grains, fermented foods, and dark chocolate. I drink alkaline water, green tea, red wine, and homemade goat milk kefir. I don't drink enough water according to your guidelines, but I'm close. I likely eat too many carbs and generally sleep 6 to 7 hours a night. I go to a chiropractor twice a month. Several years ago, I weaned myself off of medications for high blood pressure, ventricular tachycardia, enlarged thyroid, and sinus allergies. I still do not take any medication, but take lots of supplement. I see an endocrinologist yearly. My annual blood work has been in the normal range for many years, except for a white blood cell count, which is slightly low. My D level is 67. We like it to be around 80. I took hormone replacement therapy for 9 years in my 50s and 60s. I'm currently under some stress due to family issues. I had a total knee replaced 11 years ago, revision surgery several months later. I have not had any shots. My blood pressure was always running on the high side. I take hawthorn tincture, fermented beet powder, flaxseed, CoQ10, vitamin E, magnesium, vitamin D, K2, garlic, cayenne, several other things, including quercetin, vitamin C, minerals, glutathione, and more. A long list. I appreciate any advice you can offer and wish that you were taking new patients. May God continue to bless you and your family. Thank you so much for your prayers. They're certainly needed. And it is God that is our hope for all of our needs. Now, it looks like you're doing many, many wonderful things, Cynthia. And so I am going to suggest enzymes, systemic enzymes like Vitalzyme or Vascuzyme twice a day on an empty stomach before you go to bed and right after you wake up in the morning. And I would get a rebounder. A rebounder is that mini trampoline with a bar. And I would, first thing in the morning, get on the rebounder for 3 to 5 minutes just to get the lymph and the circulation going. And then I would do the rebounder in the evening. And then I would find a doctor who does edeticylation therapy because that improves circulation as well. So between a rebounder and the enzymes, drinking enough water consistently, chelation therapy, and a Beamer. I don't know if you've ever heard of a Beamer mat. We have them here in our IV suite, but you can get this for your home use. This is well-established science that this tiny microcurrent is associated with helping the nitric oxide and dilation. So a Beamer mat you might put under your bed and turn it on every night for a cycle. That'd be a direction I would go. And may God bless you, Cynthia. And watch your blood pressure, and if it's going up and you have to go on a blood pressure medicine for a season, get on it with your doctor, and then we can always look to see if it's possible to get you off. So don't not use blood pressure medicine if you do need it. Deanne says, hi, Dr. Rita. A friend has high blood pressure. What are the natural ways to lower it? The medication makes her feel bad. Thank you for being there to answer our questions. So I just reviewed it with the prior woman, the EDTA echelation therapy, the Beamer mat, a rebounder for lymph massage and microcirculation, adequate water. Don't gum up and sticky up your blood vessels with a lot of sugar, starch, carb, and food allergen antibody complexes, and go from there. Carol says, my friend has fever and seems to have flu. Do you have recommendations for flu besides rest and staying hydrated? Vitamin D, vitamin C, zinc, and if needed, hydroxychloroquine or ivermectin. High dose vitamin C, we do take walk-ins for vitamin C, but you have to call first to make sure we can fit you in. Vivian says, to fast or not to fast? That is the question. When sick, is it better to fast or not? Starve a fever, feed a cold. The body is weak when sick, so should we eat or not? And if so, what? I always fast when I'm injured, sick, hurt, anything, because I want my whole immune system to focus on that part of my body that is malfunctioning. And when you eat, blood will flow to your stomach and to your gastrointestinal system for at least 3 hours, if not more. And that's about a third of your whole blood supply, just to watch and look and make sure there's enough white cells and stuff around your immune system lining the gastrointestinal system to protect you from what you just ate. So I am for fasting anytime you are ill. Now, if you're not getting better in 2-3 days, then you have to eat something. And I would say while you're fasting, if you have to have something that first 24 to 48 hours, I would have broth, chicken broth or beef broth. And that'll give you all the salts and mineral electrolytes you need, and go from there. So that's how I would answer that, Vivian. Let's see, Chris says, hi, Dr. Ellithorpe. I got my diagnostic report from you and think you are concerned about my triglycerides at 93. I know I eat too many carbs, and I'm wondering about a metabolic reset program that I heard about. It is basically going 4 weeks eating only eggs, meat, and cheeses. Do you think this is a good idea? I do. Basically, that's a carnivore diet. I haven't been eating cheeses or eggs due to stomach issues, but the doctor that talks about the program says it will clear up gut issues. Here's the link to the doctor telling about the program. There are 4 videos, but I'll just send you one. So she put the link here for me. I'll see if I can get time in, Chris, to take a look at that. One of the reasons is the meat, cheese, eggs, it's full of these phospholipids that you see here, this double line right here, the phospholipids lining from all the way down to your gut. And we have been frightened away for the past 50 years from eating this. So we have not good shingles covering our cells, like the roofs and the windows have cracks in it on the exterior of our cells. So by eating this, it tends to help strengthen the lining of your gut, and you can digest better and stay healthier longer. So 93, most doctors would say, what on earth are you saying 93 is a concern? Well, 93, what I've seen over 40 years plus of practicing medicine is before you become a diabetic, and I see people eat way too many carbs, I see their blood sugars when they're fasting. If it's 90, 93, then their triglycerides are 90, 93. And then, we tell them, please cut back. And then they come back 6 months later and their fasting blood sugar is 95 and their triglycerides are 95. And I'm telling them, you're still eating too much. You're playing too close to the street or too close to the cliff. One of the other example I like to use is on missionary work in Ecuador. We went up into the mountains, and those people in Ecuador who are mountain goat people, they were from, I think the oldest man up there was maybe 100 years old or so, quite a few very elderly people, and then all the way down to the young boys. And these guys would go out after eating, and in the morning their breakfast, but we got their fasting blood sugar, and their fasting blood sugars were 45 to 55. Then they would eat their like curds and beef jerky. That was their main food, because they weren't agricultural, they were herdsmen. And then we would check their blood sugar an hour after eating, and so they would double their blood sugar. So if it was 50 to start with, it would be 100 after eating in an hour. Then they'd work all morning, and then if we got their before lunch level, it would be back down to 50, and they'd eat again their lunch, and it would go up to 100, and then they'd work the afternoon, and we'd get their before dinner reading, and it would be again 50, and then after dinner it'd be like 100, 105. But then they wouldn't work through the night, they'd sleep, so that blood sugar would serve them. So their blood sugars were always going between 50 and 100, 50 and 100, 50 and 100. Now, when I was in training as a young doctor, I remember being told, oh, you want to get your diabetics always to have a blood sugar, try and get them to have their fasting blood sugars at least 120, and then they're under good control. Well, where did 120 come from? That's because we know cell damage begins at 120. Some will argue 140. But most Americans have been lulled into thinking that a fasting blood sugar of 90, 99, 104 is fine. And the minute they put anything in their mouth, their blood sugar is shooting up well past 180 to 200, and God forbid even higher. So we Americans are in high blood sugar ranges throughout the day, and then our insulin pulls it down, and then we shoot back up, so we're in the damage zone way too long. So this is what I think is the real problem with it, Chris. That was a long answer. Carol says, I suggested DHIS to my son for his allergies. He bought quercetin at store, and his doctor said that he should not take it because his labs show liver damage, asking what he was taking. Maybe he was taking too much quercetin, so when I visited him, I left him some DHIS to show him the better product. But would quercetin alone cause liver damage? I've never heard of that, Carol. Never in decades and decades and decades of using it. He drinks beer often and exercises daily and is healthy for 52. Well, I think the reason really is these liver enzymes are from the doctors who are allowing these high blood sugar levels, and they're damaging, and then you bring it down into a range fasting that's barely passable. So no, I would not say it was the quercetin at all. Constance says, I have heard that there is a fluff test as part of the LDL reading for cholesterol that further breaks down the LDL info, showing all the good part of the bad LDL. What is this, and can it be added to my blood test next time? That's the particle size. The larger, fluffy, big LDL cholesterol is the healthy form. The small, tiny ones are the dense, small particles, and they are the damaging ones. And yes, it can be added in. It's called an LDL subfraction. Isabel says, good morning, Dr. Althorpe. Hope all is well with you. Praise God. All my sins are paid for, so everything is always well with me. My lips have been chapped for a few weeks. Been using Vaseline a couple of times a day and before bed. Also tried Carmax, which made my lips puffy with a burning sensation. I don't know what Carmax is. Any other suggestions you can share? Thanks so much. I use, my moisturizer is my liquid clinician's preference. So I just flip this up and I put a drop on my finger so that it's shiny now. And I put it on my legs and my skin. And why do I do that? Because that has the essential fatty acids that your skin needs. That's linoleic and alpha-linolenic acid. And part of the connection of the biolipid, membranes is to have that essential fatty acid. There's only 2 in a human, and this is it right here. And I take this every day. So that's what I would do. I carry it with me all the time, but I don't go anywhere. So it's either here or on my desk at home a mile away. Dorothy says, "Hi, Dr. Rita. You are really rocking many people and helping so many." Well, glory to God. I'm only doing that which God has enabled me to do. If I could tell you how grateful I am and so appreciative of all you are doing and have done, God bless you. I am telling people about your YouTube live Q&A and emails. Even my neighbor is listening. Dr. Jesus overrode all of the doctors I have seen and showed me the exact root problems and solution in my prayers. I agree that Pilates is best for me, but first I have to do some slow special moves to build up to that point. So I'm following the free videos of Matt Hissu of Upright Health, who is specifically trained in corrective bone and posture exercises as a corrective rehab specialist. Once my hip muscles get stronger and more flexible, I will enter Pilates. I am feeling so much better already, and I'm faithfully doing the special hip moves from his expert care with great compassion to see people recover. He is an angel and direct answer to my prayer also. I am doing what you instructed me to do. I feel so much better. My range of motion is increasing. You are right. We don't get enough exercise and need more water and only meat and vegetables and nuts. What is best form of Pilates? I saw a new studio with bungee cord jumping also. I'm not a specialist in that, Dorothy, so all I can say is I go to Pilates twice a week for an hour, and I work with a dear Christian lady about my age, and she's very sensitive, to my limitations at nearly 70 years old, and I just feel wonderful. But I also do heavy weightlifting 3 times a week with another trainer. So between building up the muscles and then stretching them with Pilates, I feel, probably like I did in my mid 40s. Well, God bless you, Dorothy. Jenna says, Dr. Rita, I am 55-year-old healthy female taking your TLC metabolic formula that helps you metabolize your sugar better and reducing my A1C. Wonderful. And am not taking any prescription medicines. I am having a yearly checkup with my primary care physician in 2 weeks. I know he is going to tell me to get a flu shot. Do you get the flu shot? Should I? What do you recommend? Also, what is your recommendation regarding the 2-part shingles shot, and at what age should it be taken? Blessings, Jenna. I recommend vitamin D. I recommend zinc. I recommend vitamin C. I recommend high-dose vitamin C. I recommend a good night's sleep. I recommend exercise. I recommend drinking enough water. I recommend a low-carb diet. I recommend not eating late at night. I recommend going to bed earlier and getting up earlier. I recommend, systemic enzymes. And I recommend eating a humble diet and leaving all the wild eating to true days of holiday activity, like a Christmas dinner, Thanksgiving dinner, and so forth. That's what I recommend. So there you have it, Jenna. And now you know what I do. That's what I do. All right. Denise says, hi, Dr. Rita. Is glutamic acid beneficial amino acid for a 92-year-old? I think we already answered that. And we're talking about the excitatory glutamic pathway, glutamine pathway that can irritate the nerves. So I would stick with the humble things in life. Jenna said, does everyone need to take electrolytes? The answer is yes. And, the most dense nutrient foods are meat, fish, chicken, turkey, beef, eggs. I know the heart functions on sodium potassium balance, plus so much more. It has to have a healthy cell membrane. If you don't understand, you can have all the healthy amounts of salts and minerals and antioxidants and herbs you want. But if you don't have the phospholipid from eating meat, fish, chicken, turkey, beef, eggs, yolks to fix these things and to get it looking nice and healthy like this, then what good are all your electrolytes? So it does matter. Everything does matter. A knowledgeable friend said everyone needs 2,500 milligrams of sodium, 4,700 of potassium, and no one consumes that many leafy greens or other things. I do by eating enough meat, fish, chicken, turkey, beef, eggs, and egg yolks. So should we supplement with high quality electrolytes, no sugar? What do you recommend? She recommends something called Fullscript website. I think if we would all eat, women about a half to 1 milligram per kilogram, men 1 to 1.5, maybe even 2 if they're really doing a lot of heavy workout. We need about 50 grams of protein, women a day. I would say it would be better to have 75, and men need roughly 75 to 150. And if you're eating meat, fish, chicken, turkey, beef, eggs, shrimp, lobster, crab, and those things, you're going to get all the potassium and sodium that you need. Jenna also says, do you recommend non-fortified nutritional yeast be taken sprinkled on food? No, I don't. I read it's good source of protein, fiber, amino acid, and helps manage type 2 diabetes, sugar levels, and reduce stress. Are these things true? No, I would say you could talk about a narrow square on a big floor and talk about that little square in the big floor in a gymnasium. And that's how I see these supplements. Yes, of course we need protein. Yes, of course we need healthy probiotics. Yes, of course we need these amino acids and fiber and all these things. You can have all kinds of conversations and try and sell stuff. But you want to know what really is important is trying to get people to change their lifestyles and eat healthy foods. And isn't that an interesting coincidence that they're trying, the prevailing controlled media wants you to not eat meat and to eat their fake stuff and to be a bug eater. Anyway, what a world. June says, for someone who is getting a cortisone shot for temporary pain relief for joint arthritis and tendinosis, what would you recommend to take to minimize the harmful effects of the cortisone shot? Enough water. I would take systemic enzymes. Not just 1 or 2. I would try and do 4 or 5 or 6 twice a day. And I would take a multi-mineral, magnesium, potassium, zinc, molybdenum, type multi-mineral. I would also do EDTA chelation therapy so it can reach those areas. Carla says, I am currently working with a urologist due to a recurrent infection. I will and do take antibiotics when prescribed. But my question is, what do I need to do to help my body fight infection? I'm a healthy body weight, already drinking half my weight in water, low carb, intermittent fasting, taking enzymes, probiotics, fermented foods, as well as various vitamins and supplements. I am perplexed as to why I'm not able to get rid of infections, especially with the added help of antibiotics. I will appreciate any advice. Carla, I'm going to presume that you are postmenopausal. And all women, when we lose our hormones, the lining of the urethral passage and the vaginal area there gets thin, just like the thin skin on all old men and women, and that can get easily damaged and bruised. And the structure of the urethra to hold it shut versus, if your urethra is so thin that the hole is like that, and you don't have muscles to shut the pee down from leaking out. Instead of nice thick firmness as a young woman, the thickness and the ability with the testosterone to shut off the urine flow, these kind of things show just the breakdown of aging. So natural hormone replacement therapy is the direction I would probably go, Carla, because it sounds like you're doing everything else, and I would see a functional doctor that knows what they're doing and help you with that. Brenda says, I have low secretory IgA as shown on both stool and saliva. I am certain this is due to stress over the years. Thoughts on how to increase this, and can this cause inflammation? The answer is yes, because secretory IgA is in your saliva and in the secretions, and that's part of the reason why we give SBI Protect powder. This has the immunoglobulins that are very rich and supportive along the lining of the gut. And of course, a low carb diet, eating a simple diet, not a wild, crazy diet full of spices all the time and changes in variety every time you eat. So the more simple you eat, the less stress you put on your immune system here. You might take that, something like that, with the probiotic and the fat. This is the phospholipids, those fats that make the lining here, this thing right here, with the immunoglobulins. That's how I treat it with my patients. And I very often will give them 2 weeks worth of a powdered probiotic. So a packet of this, a scoop of this, a scoop of this, and mix it in water, and then you should see it improve. Now, lactoferrin is something that is prescribed as a supplement. That is in what we call mucosogen, and it's called mucosogen because it helps the lining along here. And so we have mucosogen has lactoferrin in it, and that helps the immunoglobulin A also. Avoiding food allergies, staying low carb, using digestive enzymes, and probiotics. Manja says, hi, Dr. E. Can elevated calprotectin level in the stool? Yeah, we answered that one already. Kimberly said, given the rise in cases of flu, do you think it would be beneficial to get a flu shot? I have never gotten the flu shot given. Do they always cover the current strain? No, they never do. But interested in your opinion on this. Well, what I would do is I would take vitamin D. I would take vitamin C. I would take zinc. I would take high dose vitamin C if I think I'm coming down with something. I would eat a low carb diet. I would get a good night's sleep. I would drink enough water. I would exercise regularly. I would avoid food allergies, eat a simplified diet, and I would take a multi-mineral, that has zinc in it, and probably quercetin. I use quercetin all the time because it acts as an antiviral as well. I also use Argentyn silver, and I squirt up my nose. I gargle with it. That's what I would do. All right, so now we've done all those. What kind of questions do we have here? Let's see. Oh, it's past 7 o'clock already. Wow. Let's see if I can do anything here. Amila says, hi, Dr. E. Is it safe for young adults and teens to drink protein smoothies from reputable, like orthomolecular protein drinks? Will it cause any kidney harm? The answer, it won't cause any kidney harm. I just like eating normally, not buying protein drinks, but orthomolecular does make good products, and it will not hurt the kidneys. Everyone is moving to Rumble. Yeah, E2, I should probably move to Rumble, shouldn't I? Hi, Deborah Vishulis, my sister. How are you? Here's a joke. Okay, I need one. Where do sick fish go? To the dock. Oh, yes, to the dock. Yes, ma'am. All right. I love you, Debbie. Harlow says, hello, Dr. Rita. When you use estradiol and progesterone, do you also use testosterone, and how much? I don't use testosterone. I use DHEA because that will naturally, in a woman, make my testosterone go up, because I don't want to have the level in a man. And that's enough to give me enough muscle tone. So I just use the DHEA. What would you recommend, a vitamin infusion versus chelation for severe fibromyalgia and depression? Which is more beneficial? I'm going to say the EDTA chelation, because fibromyalgia really is the chronic situation where um, your mitochondria inside your cells, those are the batteries, they need that phospholipid stuff in your diet. They need the healthy essential fatty acids, linoleic, alpha linoleic acid. And so it's only going to get there with microcirculation. Would 10 Vitalzyme pills morning and evening be beneficial for the above? Absolutely. It would help anyone with chronic pain, and then they can cut back as they feel better. But they got to drink enough water. They got to cut their carbs. They got to get into, time restricted eating. Christina says, is there a natural supplement, tea, etc., to help with depression? I would use vitamin D. I would try and get my vitamin D levels up to 100 range, 120. So you might need to use 20,000 a day, and then you do that for a month, and then check your levels to make sure it's you're handling that level well. And then I would use the Parent Essential oils, not fish oil. These oils. These are the linoleic, alpha linolenic acid. I would use 6 a day. That's the same as this liquid form of it. It's the same thing. I use this because I also put it on my body, my lips, and my hands and legs. And then I would be low carb, and I would exercise. Exercise is a very important part, very, very, very important part of mood, working as an antidepressant, and getting up in the morning outside into the sunshine before 10 a.m. and getting at least 10 minutes and kicking my shoes off and getting my feet in the grass where you can get your body grounded. So that's what I would do there. That would be the way I would approach it. Deborah says, I was on estradiol patch 0.025 and progesterone. Stop the patch because breasts throbbed even after cutting it in half. Well, Deborah, that is a teeny weeny dose, 0.025. That's absolutely too low, okay? I don't have any sex drive. I'm 55 and fit. No night sweats anymore. Thoughts? A woman, like, I have large breasts, and when I was 12 years old, starting to get my second, puberty, I had breast buds, and my estrogen was going up, and so I had very, very tiny breasts, and I could hardly feel the impact of the estrogen. But now, as I a mature, full woman with a D-sized cup, and I take hormones, I'm going to have to go through about 2-3 months or cycles with systemic enzymes and plenty of water and low carb, so that I can get over this hump from time without the hormones to the time getting back on them until I get to a baseline. And that usually is what doctors fail to tell their patients. You're going to start hormones with larger breasts than you did when you started out when you were 12. And so you're going to be more sensitive, but you'll get on the other side of it, and we'll be following you closely. And you take enough systemic enzymes and your progesterone to balance it, and a low carb diet, and we should get through that. That's how I would handle that if I were your doctor. Christina says, how much exercise a week do you recommend? I recommend exercising every day. So get a rebounder, get on that, start with 3 to 5 minutes, and have fun jumping up and down every morning. Very often it might be the very first thing I do in the morning. Even if it's just 2-3 minutes, just to kind of wake up my body, and evening, and then try and do maybe 10 sit-ups every day, and then do a 10-15 minute brisk as you can walk. Walk as fast as you can away from your door for 7 minutes and then back again. And if you had even that minimal cycle, you'll just lift your spirits and your energy. But I really believe that if we are getting older, especially if you're 40, your muscle mass is going to wane. You have to do weight training. You have to do resistance training. Sarah says, hi, should an overweight person eat protein according to their current weight or according to their lean body mass or some other measurement? Unless that person is morbidly obese, like weighs 400, 350 pounds, I would say I would go by their weight. So if they're 200, 250, I would say probably 1 milligram per kilogram. So a 200-pound person would be close to 100 grams of protein. 250 would be 125. That would be the range I would go for, Sarah. Constance says, I emailed question, is the LDL cholesterol fluctuate? Yeah, and I answered that. That's called the LDL subfraction. There's ApoB, there's all kinds of nitpicking. Let's not worry about that. Let's worry about eating a low-carb diet and exercising and drinking water. Let's stop looking and saying, how close are we to the cliff? Let's just drive away from the cliff and put all that esoteria over to the side. It never made any difference. It is the triglyceride, and the studies are coming out and proving us right. Carla says, what's the difference between prebiotic and probiotic? Prebiotic would be getting in the insoluble starches and cellulose and stuff that probiotics need to eat. See, we can't digest prebiotics, so that'd be like the artichoke and inulin that's in some of the vegetables and things like that. So prebiotic is the food for the probiotic. And so we did put into the bar both prebiotic and probiotic. So that is why we have such good bowel movements, because we really feed our good bacteria. And then finally, Leah said, there's a few more. So no more questions. Leah said, if I take several supplements, is it okay to take them all the same at the time, or should they be spaced out? Well, I take all mine. I usually have a bunch in the morning and a bunch in the evening. The only thing I take with eating are my digestive enzyme. And Sarah says, should an overweight person eat protein according to the overall weight? I got that one already. Okay, and then not sure if my questions are coming through. Yes, yeah, they are coming through. Okay, well, praise God. And we thank and pray that all the children are safe today. I so dislike this day. I so am against this activity. But I pray for their safety and health. I pray that we don't allow our kids to abuse this sugar and this concept of what October 31st is marketed to be. But with that, I just want to say I am probably going to switch from Mondays to Tuesday nights. I am just way too busy, and I have to get a free day in my life to get something done. So Tuesday nights or Wednesday nights are the nights I'm going to be moving to. If you could type in here what your preference would be. Would it be a Tuesday or a Monday night would be best for you all? Because I can't really do Monday nights anymore. It's just too overwhelming, and I do need to take care of my own health. So please type in here and let me know. Tuesday night, Tuesdays. Okay. And then you might go down in the thing here and send it to Talon and the team and just say, we'll go with, all right, so any day is fine. So it sounds like any day versus Tuesday. So let's plan for next week on Tuesday, okay, folks? And may God bless and keep you and lead us all to love our neighbor as ourselves and love God with all our heart, mind, and soul, and read our Bibles, fill ourselves up with his word. All right, God bless you all. Take care. Good night.